Hello, and welcome to the Natural PCOS Podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello everyone, I'm Dr. Samina Mitha, naturopathic doctor, and welcome back to the Natural PCOS Podcast. Today I'm talking about testosterone, my personal journey with testosterone, and hopefully I'll be able to really allow myself to explain, the science behind testosterone and what's going on when it comes to PCOS. First things first, where is testosterone actually coming from? When we test testosterone in the blood, oftentimes it looks really normal in women, especially women with PCOS, which begs a difference. Like, why is this normal when, we're having all the signs and symptoms of high testosterone? Oftentimes we can't really get into where the testosterone lives because a lot of times it lives in the capillaries and the molecules are pretty small. And even the reference ranges are not really accurate for women with women in general. And so when we look at the different types of testosterone, first, we need to figure out, are we actually testing all the testosterone markers? Because sometimes if one marker is missed or two markers are missed, and those are the ones that are actually high, then we actually, realize that we're missing this marker and this is where the testosterone is actually coming from. So when you're getting lab work done for testosterone, you really want to make sure you're getting all markers tested. This goes for free testosterone, androstenedione, DHEAS, and total testosterone, DHT, even potentially dihydrotestosterone. And those are the biggest ones when it comes to testing testosterone to really figure out where is the actual testosterone coming from. There's two places that we build testosterone. One is in the ovaries, of course, and the other one is actually in our adrenal glands. These are the glands that sit on top of the kidneys that release cortisol, our stress hormone, and this is where we can also produce higher levels of DHEAS, especially in women with PCOS. Now, these types of testosterone are precursors to actual testosterone, so they don't actually sit on testosterone receptors, but they get converted into testosterone, and that increases the amount of testosterone in the body. We talked about, what labs to actually look for, but, let's go back one step and talk about the signs and symptoms of high testosterone, because Rotterdam criteria for the diagnosis of PCOS says clinical signs and symptoms of high testosterone and or high testosterone in the bloodstream. So clinical signs of high testosterone that we see are things like cystic acne, that hormonal acne that sits along the jawline here, really deep. You can't pop these lesions. They're really deep and sometimes can be painful. Also hair loss, so androgenic hair loss, usually like in this top crown area. And we usually see the follicle coming out. So when the hair is falling out, if you look at the hair, is the root actually there? Because that means the testosterone has gone into that follicle, caused the inflammation, and that's where the follicle is falling out. So hair loss, acne, and then the last one is hirsutism. So that excessive hair growth, kind of all over, but predominantly women with PCOS will report that it's, this upper lip, chin area, but even on the chest, abdomen, arms, legs, pretty much everywhere. So there's actually a scale that you can use to assess for hirsutism, and this is called the Ferryman-Galloway scale to actually look to see how bad the hirsutism is. And oftentimes when we look at all these symptoms, are the symptoms actually present? And if they are, that's already one check mark. Also, if you're somebody who has experienced acne in the past, but maybe has used something like Accutane to really deal with the acne and now it's completely gone, that's still a sign that that testosterone is high in the body, even though you dealt with the acne previously. Another thing to also consider is if you've used things like birth control or you're on it currently, this really reduces testosterone, so you might not see the signs or symptoms there. And even if you get your blood work tested, which you really shouldn't be testing hormones when you're on birth control, because it down regulates all the hormones. But if you do by any chance, it's going to show that testosterone is low. There's something called sex hormone binding globulin, and this binds up all the testosterone and reduces the amount of free testosterone that's available in the body to go onto those receptors to cause some of these symptoms that we're seeing, the acne, the hirsutism, the hair loss. So what we want to do is we want to try to increase sex hormone binding globulin. One way to do that is actually taking flax seeds. So 2 tablespoons ground up flax seeds. So you want to buy them whole, grind them up yourself, and take 2 tablespoons. In the actual seed is where we see the flax oil, which has those phytoestrogens that helps to, support the body when it comes to increasing sex hormone binding globulin. And when it comes to testosterone, the biggest thing is all of these, unwanted symptoms. And so when I was first diagnosed with PCOS, my biggest symptom was acne, and irregular cycles, but acne was really, really, really bad. And I remember like having to use really thick makeup to just make it go away or make it look like it wasn't there. And so I talk about this and I feel like I can't believe I had to go through that. But now I'm so grateful that I actually have the tools in order to like help keep my skin much more clear. Today I have a little pimple over here, if you can see it. But basically, I was wearing a mask last week because my daughter was sick. And I think it's from that. But really finding out why the testosterone was high in my case made a massive difference in terms of managing my PCOS. There was 2 areas that I was experiencing testosterone. I had higher levels of DHAS. It's gone up and down throughout the years, but this again is a type of testosterone that comes from the adrenal glands that produce cortisol, your stress hormone. And typically when my stress is pretty high, a lot of times my DHAS can go up. So what we've seen in the research to help support higher levels of DHAS is one is yoga, can be really helpful. And we know yoga like really just forces you to take a moment to do some deep breathing, which can really help the nervous system. And also just putting you into those positions can really just help support that blood flow and also the stress, and increase serotonin, our happy hormone. So yoga for higher levels of DHAS are really supportive. Another thing that can be really helpful is taking herbal products that can help lower stress. Something like a Relora, ashwagandha, even just calming herbs like passion flower, valerian root, depending on the case. So really helpful when it comes to reducing stress and anxiety, supporting that DHAS level. Another one, actually, L-theanine, comes from green tea, really helps support somebody who has like a monkey brain. So what I did for 1 month actually is I started to do 10 minutes of yoga a day. It wasn't even a long stretch. And I did it for about 30 days. And I really noticed that my cycles were getting much better and my stress was getting much better. I found a huge, huge difference when I was really focusing on my nervous system. Another thing I experienced were higher levels of DHT. When I first tested this, I remember it was high. And so this DHT is a more potent form of testosterone. And so the way that we reduce this is we try to reduce an enzyme called 5-alpha reductase, because basically what's happening is this testosterone is getting converted into DHT, and there's this enzyme that's allowing this conversion to happen, 5-alpha reductase. So there's been quite a bit of information on figuring out how do we reduce 5-alpha reductase. If we reduce the enzyme, we will reduce this conversion. So things that can help reduce this enzyme and the conversion is things like zinc, reishi mushroom, spearmint tea, also the flax. So those are big things that can really help support reduction in DHT. Saw palmetto, which is a really, prominent herb that we talk about when it comes to lowering testosterone levels, and really only helps lower that 5-alpha reductase. So if DHT is high, that's where we want to be really focusing our attention on. I've actually did a little bit of an experiment too, is only taking 1 cup of spearmint tea a day over the last few weeks, instead of the 2 standard cups that has been shown in the research. And I really noticed a difference in the number of times I have to deal with the hirsutism. I have used laser in the past. That was helpful for me, but still, laser isn't going to solve the problem. It's not going to take the hair away completely. What it's going to do is it's probably going to reduce the number of times you have to deal with the hirsutism, but it's not going to take it away altogether, since it's a hormonal issue. I also found, for me specifically, and I've seen this in the women I work with, is lowering the amount of sugar that I was eating was really helpful in lowering a lot of the testosterone symptoms I was experiencing. My acne got better because I reduced the sugar and also dairy from my diet. And that's when I started to really see a change in my skin. And then here and there, when I'm in a stressful episode, something's going on in my life, maybe DHEAS goes up a little bit, and then I notice my skin get a little bit worse. So if you're experiencing acne and you think it's related to testosterone, I would even try to figure out where the testosterone is actually coming from. Is it from the adrenal glands, or is it from the ovaries? And you can do that with blood testing, but then also working with someone like a naturopathic doctor to really figure it out. I also started to change the carbs that I was eating. I remember walking into naturopathic medicine school, and this is when I was like really learning and trying to focus on my PCOS, because I wanted to go into this next 4 years of my life learning everything I can about hormones and PCOS. And so I even went paleo, really focusing on the different carbohydrates that I was consuming, like starchy vegetables, and then also things like quinoa, more complex carbohydrates, brown rice, quinoa, millet, buckwheat, all of these types of ancient grains that we have. And I found that that was really helpful too for me, and really upping the protein. The more you can stabilize blood sugar, the better it is going to be for not only the insulin and the glucose, but then also going to help that testosterone, because we know higher levels of insulin actually increase testosterone. So I actually wasn't taking inositol at the very beginning because I really didn't think I had insulin resistance. But what I knew I had eventually, while learning about all of this, is that I did have blood sugar issues, and that inositol was really helpful to support and manage the blood sugar issues that I was experiencing, to lower cravings, to balance that insulin, even if it was just a little bit off, or the glucose, and then keeping the testosterone at bay. And I've been using inositol on myself for many years now, and I feel like it does really help support testosterone levels. Another big one for me that I've seen and actually saw in the research yesterday is vitamin D, which we know can actually lower testosterone too, which is really cool. And when I was first diagnosed with PCOS, my vitamin D levels were astronomically low. And when I brought that up, I think a lot of things changed for me too. Mood, anxiety, depression, my immune system got better, my PCOS got better too. So these are some of the things that I've experienced personally when it comes to higher levels of testosterone. I hope this kind of gives you an idea of what you can also explore in your PCOS if you have signs and symptoms of high testosterone or high testosterone in your blood. And if you have any questions at all, please do let me know. I'm here to support anyone out there. And that's why I really want to share my story, so that someone out there can hear this and learn something, and hopefully it translates into supporting their PCOS. So thank you so much again for being with me on this episode, and I'll see you in the next podcast. Bye, everyone. Thank you for tuning in to the Natural PCOS Podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey, and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.